Let's start it. Good morning, and thank you for joining Webinar Wednesday with Pamela Care Connections. We are so excited to have Jessica Seal with us today. She's our presenter, and we are going to get started in just a moment. I would like to go over just a few little housekeeping. If you have any questions during the webinar, please type them into our Q&A box or into our chat. Questions will be answered at the end of the webinar. If you have if you feel like you missed anything, don't worry. This webinar is being recorded. Slides and the recording will be available after the webinar has ended. We will email those out to you. So thank you for joining. I would like to share a little bit of background about our speaker today, and then I will pass it over to her to get started. Jessica joined the South Carolina Office of Rural Health in 2018 as the Workforce Program Manager. She currently serves as the Director of Behavioral Health Initiatives and Workforce Development. As the director, Jessica leads SCORE's efforts to eliminate barriers to mental health care and reduce the stigma surrounding mental illness and substance use within rural communities. This work includes suicide prevention programs and collaborations to address substance use disorder and opioid use disorder. Jessica is the program lead on developing recovery supportive employment in the Appalachian Mountain region of South Carolina, also known as DREAMS. This project is funded by the Appalachian Regional Commission Inspire Grant. As a Columbia native, Jessica received a bachelor's degree in social work from Columbia College and a master of public health from the University of South Carolina. Prior to joining SCORE, she worked in the healthcare field in various capacities, including marketing, management, and community education. She currently serves as the president of the National Rural Recruitment and Retention Network and on the board of directors for Westview Behavioral Health and CARPS SC, a rural recovery community organization. She also serves on the advisory board for the South Carolina Center of Excellence in Addiction. So we're going to welcome our speaker at this time, and while she is getting ready, I'm going to pull up her slides.
Thank you, Davia. I see some of my community partners on here, so I feel like we've got some good folks on here. So thankful. Shout out to Eric and Laura on here who I work with who are aware of this project too. So thankful for them to be here and support this. So this is gonna be pretty informal. I'm so thankful that Davia gave me this opportunity. Palmetto Care Connections has been a longtime partner of our office, the Office of Rural Health, and Davia specifically has really supported a lot of my behavioral health efforts. This is a new project. We've been doing this grant, I guess, a year and a half now, but I'm very interested in it because we, as folks that work in public health and in behavioral health, oftentimes stay in our own, our own corner, our own bubble. And this really gives us an opportunity to expand out and have conversations with folks that that don't necessarily eat, sleep, and breathe this work, and that's businesses. However, I would say that this is appropriate for anyone that employs people in the state of South Carolina. So we're going to talk a little bit about what a recovery and mental health supportive workplace would look like. As well as the opportunity for businesses to use telehealth to support their employees. So just to kind of lay some ground here, behavioral health, and when I talk about that, encompasses mental health and all substance use disorders. So we're going to use the term behavioral health. And what are the impact on workplaces? So we know if folks are dealing with mental health challenges or substance use issues, there's going to be a decrease in productivity from that particular employee, a possibility of increased absenteeism, and potentially to the employer, higher healthcare cost if they are covering insurance for their employees. Next slide. So, why is it important to address this in workplace culture? Because we know, according here to our data source, Permanente, mental health conditions contribute to 62% of missed work days. So, I don't know about you guys, but my organization, I'm happy to say, allows us to take mental health days as sick days, and I certainly take advantage of that. So, I think that's really kudos to our office. I know other organizations do that too. And it's a way for employees also to be transparent about it because we know some folks call in sick and they don't necessarily want folks to know what's going on if it is a mental health challenge. And so being able to say that and that being a part of your workplace culture is very important. We know that you see here $99,450 is a cost per employee for untreated depression per year. Again, you're looking at absenteeism and loss of productivity, and 80% of employees who receive treatment for a mental health condition report improved job satisfaction. So that's basically saying if they are able to access care, it's definitely going to roll over into their job performance. And I think that's very, very important, especially in the climate that we work in today, where it's really important to try to keep good employees. And the cost of recruitment is pretty high for folks. So we want to keep those folks and we want to keep them healthy, not just to better our business, again, but also for the overall way that the business is viewed by the general public. Next slide, please. So what does that look like in South Carolina? So in February 2023, just over 33% of South Carolina adults reported symptoms of anxiety or depressive disorder. I just want to point out that this is self-report. So we know that number is probably a lot higher. I was just on a call with a professor from one of our technical colleges, and she said that probably 90% of her students had expressed that they were dealing with some type of anxiety or depression. And that's it's kind of scary. In 2022, over 20% of adults with symptoms of anxiety or depression were reported of needing care, but did not receive that. Now, that could be for multiple reasons. It could be that they're not able to find anyone, they're not able to afford care. They may not be able to leave work and access care during your traditional working hours. And then among adults aged 18 or older, 7.8% of those experience mental health and substance use disorder, a co-occurring disorder. I would venture to say, and I bet some of my folks on this call right now would agree that that's probably a higher number now. And then as of 2023, 43 of our 46 counties in South Carolina are designated as mental health professional shortage areas. In rural areas, that is exacerbated. You definitely see clusters of folks in our more urban areas. But even in those areas, folks have difficulty getting in to see anyone. Next slide. So why should a business provide behavioral health support? This is a slippery slope. Businesses don't see themselves as getting involved in this. Some would say this is your private business. We don't want to infringe in folks' personal lives. But I can tell you that I have been working with a person in one of our rural counties, and we went and presented to two rural businesses industry that have folks that were on shifts. They allowed us to come in and talk to the various shift workers. Um, And every single time that we presented, I would say more than half of folks came up and spoke to us after the presentation about behavioral health. And we were really just talking about, substance use, mental health, what that looks like, suicidal ideation, what resources are available to you, just to kind of educate, debunk stigma, and then again, provide those resources. They all needed more support. Maybe not for themselves, but for their families, for their friends, for their neighbors. Every single one of those different shifts were very interested and really expressed that this was important to them, and also thank their employer for having us come in. They saw that as a value and they appreciate it. So some of the barriers that we know that folks again are experiencing when they're trying to access care is the cost. They may not have insurance that covers it, or covers it to the point where they can afford it. They may have limited, again, accessibility due to their work schedule. It's very hard to find counseling or support outside of normal business hours sometimes. And if you work in an industry where it's really hard to leave, or you only get maybe a 30-minute lunch break, it would be really difficult to seek care, or even take a family member to receive care. Also, stigma. Folks still, and sometimes it blows my mind, don't want to access care, or even talk about it or ask for anything because they're embarrassed. Some folks see it as a weakness, or are afraid of judgment, specifically in their employer, with their employer. And then transportation, which is why I think it's really important that we're doing this webinar today and talking specifically about accessing care through telehealth supports. But I believe that if creating a supportive work environment can really begin to address pretty much all of these barriers. Next slide. So specifically, the project that I am working on here in South Carolina, I will go ahead and mention that it is for Pickens, Cherokee, and Union counties only right now. Obviously, our funding is coming from the Appalachian Regional Commission. We have 7 Appalachian counties in our state. But I will tell you that we have applied and are hoping to receive additional funding to be able to expand this project out across South Carolina. So what is a recovery-friendly workplace? So this is one model that we're really promoting, and it's really increasing job opportunities for individuals in or seeking recovery. This is specific to substance use disorder, but I have to tell you that it certainly would also include mental health challenges. It encourages employees with substance use disorder to seek help and to be open with their employers about that. It provides access to treatment, recovery support, and peer services. Um, it also informs employees of their rights to accommodations and protections. So we make accommodations for folks that are experiencing other chronic diseases, but sometimes we don't do it with mental health and substance use disorder, and it is a chronic disease. It also prevents substance misuse through education and workplace safety. And this is again educating current employees and those future employees in a business. And what I tell businesses when we're talking about this is, when they give resistance of looking at hiring folks that have a history, my comment to them is they're probably already working there. You just don't know about it. Wouldn't it be great to be able to keep those folks and support them and let them know that you care and you understand what they're going through? Also, educating staff at all levels to reduce stigma and promote open dialogue, which is sometimes why folks won't say anything, again, because they fear judgment from their coworkers. And then clearly communicating recovery-friendly policies and resources to all employees. Again, all of this is being completely transparent with your employees, creating a culture where folks, instead of hiding, can be open and say, "Hey, I'm experiencing this," or "My family member is, and I need a little extra support." And that 9 times out of 10 will keep that employee there. And it also lets them know that they are working in a place that genuinely cares about them. Next slide, please. So this is not a new initiative that we're coming up with in South Carolina. Other states, and this is just a sampling. There's a significant amount of states, especially recently in the past year or two, that are really looking at this. These states that I included here, with the exception of North Carolina, you'll notice there are not a lot of southern states on here. We have a long way to go. But I have to say that New Hampshire really is the flagship for this. They had buy-in from their governor, who really supported this, thought this was a great value to businesses, to the economy there, to the workforce. And they, put in support and funding to really make this a statewide initiative. So all of these different logos you see here, these are statewide initiatives. These are websites that are dedicated to recovery-friendly workplace support in their state. And there are also incentives for businesses that they can take advantage of for this. So there's a lot of benefit to businesses at least looking at this concept and implementing some sort of policies around this. Next slide, please. So why is telehealth important to this? So we want to develop these strategies, develop these resources. We don't want them to be a passing fad. We want this to be something that going forward is just part of a business's culture. Maybe it doesn't even have a name. It's just something that's understood that businesses offer. So telehealth is a great strategy for this because we know it is not a trend. It is a long-term solution. It is something that has already been identified as integral in building resilient, healthy, and high-performing workforce. There are organizations that do this for other, for their employees to seek care for, whether it be diabetes, heart disease, have a family practitioner on site, really taking care of employees where they are. Specifically for our rural communities, it addresses barriers such as transportation, again, with our mental health. It can reduce stigma. And number one, it can keep folks there where they can still work, have a work day, but also know that they can take some time away in the middle of the day to be able to access care. This telehealth for this particular project aligns again with that overall workforce wellness goals. There are some initiatives here in our state that I've been talking to, like the Healthy Business Challenge. And I'm like, hey, what does behavioral health look like in this? And that's something that they hadn't really been doing a whole lot around, but we're going to change that. And the biggest thing, I guess, when you talk to businesses, because hey, we have to look at the bottom line. That's very important. Is there is the potential for overall reduction of healthcare costs to employers, not just for time away, but again for that insurance piece, for EAP. It really can be beneficial to the bottom line of an employer. But we want it to also support employees, number one. Next slide, please. So if this sounds great, and again, I don't know if there are any businesses on here, but I guarantee that, the folks that are on this webinar right now and folks that will hopefully listen to this in the future, you have engagement with some business, whether it be a family member that works for a business, whether it be a business that you frequent, that you own. This is, again, it can be our organization here at the Office of Rural Health. We've talked about this. What does this look like from our perspective? Are we implementing these policies? And so the first thing you want to do if you're really thinking about implementing these policies, and for the purpose of this webinar, my vision and what I had told Davia is, especially for our larger employers, wouldn't it be great, and this is happening in other states, to have a space in the office or in an industry dedicated to providing telehealth care? So it would be a private space. And it would be an area where folks aren't ashamed to go visit. It could be for any type of care, but in the inclusion of behavioral health care, I believe could really be a benefit to, again, the employer and the employee. So if you were interested in doing something like that, I think that obviously Palmedicare Connections would be your first a line of folks that you would want to talk to. But you would want to develop an internal task force in your organization. Choose a few folks. Certainly, you want employees to be a part of it, and just kind of privately understand what's going on in our workplace. And I'm going to share something with you guys of why this is so timely and so personally important to me. I just told Davia this before I started this call. So about a week and a half ago, I got a call from a previous employer of mine that I still keep in touch with. I haven't worked there in 20 years, but still keep in touch with them. It's a great organization. They're now a corporate owned organization. And they had a staff member that gave no indication of any distress at all. And this person ended up taking their own life in the middle of the workday, and their staff was there. Other folks were there, accessing the business, and it was traumatizing for those folks. And they sent counselors in to talk to the employees, but they feel like they need more. And I couldn't help but think about this presentation that I was putting together. And I just felt like it was important to highlight, people spend more time at their job sometimes than they do with their own family and friends. We need to be aware if we can. And again, I talked to some of these employees and they said we had no indication. This person was a little more quiet that morning, but I mean, no different than some of us are when we're, having a morning and not really talking to anyone. And I just thought, what could it have been like if there was more open dialogue and there was a greater access to care there on site? I don't know if it would have, if that person would still be here with us, but I think it was at least worth thinking about. And so I think that really assessing your workforce behavioral health needs is super important. We don't know what's going on around, our employees or our coworkers. Maybe something's happening and this is the place that they come, the only place that they come where they have some peace and quiet. Maybe this work is their getaway from a situation that they're not telling anyone about. So if we could conduct anonymous surveys, within our workplace about what does stress look like for you? Are you experiencing any job burnout? Are you wanting to access services and just can't? Are you aware and have any familiarity with telehealth, and what could this look like if we offered a place here in our workplace where you could access care and not have to leave and do it in a private way? Would that be something you'd be interested in? So again, developing a survey of your employees, keep it short, make it mobile friendly. When I hear survey, honestly, sometimes I roll my eyes. I feel like surveys are everywhere, but I think this is one that's worth it. And I think if folks know that it's anonymous and you're really asking these questions to build a healthier workplace and to support them, I think they would take the time to fill it out. Again, that transparency, letting them know that, hey, we know this is an issue going on in our country. It's no, no surprise. All you have to do is turn on the news or read the paper or get on social media, and we know that folks are dealing with things that they weren't dealing with, or maybe not out loud 10, 15 years ago. And, when I was talking about the professor, she said this new generation, and I've seen it too, they're going to demand more. They're going to demand things like this in the workplace. It's important to them. So I think thinking about the future workforce is very important, and this is actually could be a great recruitment tool. So next slide, please, Davia. So let's see, where would you start? Assess workplace culture and support systems. So we're talking with the managers or the staff. Let's look at our managers. So as a manager, do you feel equipped to talk about behavioral health with your employees or your staff? Do you feel like as a manager that there's a culture of openness and support? And again, anonymous. Encourage folks to be totally transparent and tell the truth. And do you think the policies that you have or that your organization has are supporting behavioral health? Again, this isn't punitive in nature. This is just to make things better. Another idea is to host employee focus groups. If you have a large enough employer, I say pull folks from all different areas. Again, letting everyone know, very, very, very important, that this is not something that we're going to hold against you. This is not something that's going to come back and bite you after, you give all this information and your manager is going to find out and you're going to be reprimanded or made to feel embarrassed about what you've talked about. I think it's important if you do something like this, if you have the funds or you can, to get a third party facilitator. So have someone that's not at that business, that's not at the employer or the employee, that's, has expertise in this to come in and facilitate these focus groups. So folks having, an equal opportunity to tell what's going on and to do it in a place where there's no, inferior, it's not the manager versus the employee, that everybody's kind of on a level playing field. Next slide, please. So you want to evaluate also through your HR is, and you can do this, looking at existing benefits and gaps. Look at are there trends for people in sick leave and absenteeism? What does your EAP usage look like? I work with an EAP really closely in South Carolina. They serve on a coalition that I work with, and you can get that data. You can't get specifics, but you can know if folks are utilizing it. And that's super important because when I was talking about going to these businesses, one of the things the employees said to me was, we didn't even know we had an EAP. What is an EAP? And the other question was, if I use it, will my employer find out? So there's that privacy piece. So make sure, and that's something that we've done here every year when we talk about benefits, we do a deep dive in EAP and what it covers. And it's a lot more than just counseling. Look at your short-term disability claims and also look at your turnover rates. It may or may not have anything to do with this, but it could. So you want to evaluate, your current trends, in your organization. And so say you get to the point and you say, I would really like to research what it would look like to have telehealth in the workplace. So you want to pilot a program. So your first step is to contact our friends here at Palmetto Care Connections and see what they can provide. Again, working and talking to Davia and hopefully Matt about, how do we get into businesses and start to talk about this project and program and what opportunities are and who Palmetto Care Connections is and what they can provide. But if you get to that point and you're bringing them in, you want to start small and strategic. You don't want to be a big organization and go, all across the business. Start with a specific department or an employee group. So maybe it's your full-time day shift workers. Maybe it is, a specific department within a health system. You want to set a clear timeline to pilot this project. Again, choose your telehealth provider, promote the launch internally. Again, make it, let them know, hey, we are thinking about doing this new, implementing a new benefit to you guys. And here's where we're starting. Make sure that you emphasize again how it's easy, it's private. Privacy is so important. You're really going to have to hone in on that piece. And then, after you set your time frame, evaluate utilization. What does this look like? Be prepared to pivot. Maybe you need to expand your pilot. Maybe you need to look at a different group of folks. Maybe you need to do a little bit more marketing of it and education for staff for them to understand what you guys are trying to implement and why. Next slide, please. And so I have the question marks here. And so again, I just want to remind you guys that it can be a large employer, it can be a small employer. It's for folks, all across the state. It can be a long-term project. Maybe telehealth isn't the answer right now, but that's something that you want to have as a goal, or you just at least want to do a fact-finding mission with your employees. Of is this something that we need to be looking at? Are you having trouble leaving or accessing care? Do you need to? And would this be beneficial? So, baby steps if you need to, but I would encourage folks at least to understand that as employers, it is very important for us to be a part of the solution. You don't want to get into people's personal business, but again, sometimes just asking a question, "Are you okay? And what can I do to help?" In a way that is genuine, and seeing it lets them know that you value that and that you're aware that something may be going on, and you want to support them. So that is all I have, Davia. Not sure if anybody has any questions, but I am here to answer anything you guys may have for me.
A wonderful presentation. I loved it. I will give everyone a moment to just type in their questions if there are any. We'll
That was
see.
a lot, I know. But
It
you're
was
also,
a
you can reach out to me anytime if you want more specifics, if you don't want to ask in front of everyone, or if you think about it, review it, and you just have some other, thoughts about it. I am open to also learning. So, I see some providers on here. If there's anything that you're thinking about, and maybe if you have a relationship with a business and you want to kind of take it to the next level and try to support something like this, I mean, I would certainly be open to helping you with that.
And if it's something that, if you weren't here at the beginning of the webinar, this is being recorded. The slides will be available. So if you would like to share it with your team or have a conversation later about it, this will be available for you to use. And I can share your contact information too, right, Jessica,
Yep,
in the follow-up email.
absolutely.
Yes, I do not see any questions at this time. So I'd like to thank everyone for joining. I would like to thank you again, Jessica, for taking the time to share this information. I think it is important that um, I like the beginning where it said telehealth is not a trend. And so let's
It is a
utilize the
tool.
tools that we have.
That's
Yes,
right.
let's utilize the tools that we have to bring resources and solutions to where we can fill in the gaps, where we can fill in the gaps. So thank you all for attending, and look out for the contact information and the slides. Y'all have a great day.
Thanks, guys. Have a good day.